The Lujo virus was first discovered in September 2008 during an outbreak of hemorrhagic fever in South Africa. The outbreak initially started with a patient in Lusaka, Zambia, who then traveled to Johannesburg, South Africa, where the disease was further transmitted to several healthcare workers. The virus was identified and named after Lusaka and Johannesburg, from where the cases were reported. The exact route of transmission of the Lujo virus is not well understood due to the limited number of cases observed. However, it is generally thought that, like other viruses in the arenavirus family, the Lujo virus could be transmitted through contact with the bodily fluids of infected individuals. This includes direct contact with blood, saliva, or other secretions, as well as indirect contact through contaminated surfaces. The initial patient in the 2008 outbreak is suspected to have contracted the virus from an unknown animal source, as arenaviruses often reside in rodent hosts without causing symptoms in the animals. Subsequent transmissions in the outbreak occurred among healthcare workers, suggesting person-to-person transmission through close contact. This highlights the importance of using appropriate personal protective equipment and infection control measures when dealing with suspected cases. The Lujo virus causes a severe form of hemorrhagic fever, presenting a progression of symptoms that can quickly escalate in severity. Initially, individuals infected with the Lujo virus may experience fever, headache, malaise, and muscle aches. These early symptoms are often general and non-specific, making early diagnosis challenging. As the infection progresses, more specific symptoms can develop, including diarrhea, a noticeable rash, sore throat, and nausea with vomiting. These symptoms can worsen, leading to severe hemorrhagic manifestations. Patients might experience bleeding from the gums, bloody stools, and vomiting blood, indicative of the virus's impact on the vascular system. Neurological symptoms can also occur, such as confusion and seizures, signaling the spread and intensification of the infection. Alongside these, multi-organ dysfunction can manifest, with the liver and kidneys often being affected, leading to further complications. In the final stages of the disease, patients may go into shock, and without prompt and effective medical treatment, the infection can be fatal. The rapid progression from initial flu-like symptoms to multi-organ failure and severe hemorrhagic conditions highlights the need for immediate medical intervention and supportive care in managing the disease. Treating Lujo virus infection focuses on supportive care, as there are currently no specific antiviral drugs approved for this virus. The management of Lujo virus, much like other hemorrhagic fever viruses, is aimed at alleviating symptoms and preventing complications through a range of medical interventions. Patients require comprehensive supportive care, which includes maintaining fluid and electrolyte balance, ensuring adequate oxygenation and blood pressure levels, and addressing any secondary infections that may develop. Such care typically necessitates intensive treatment and continuous monitoring in a hospital setting, often within an intensive care unit. Given the risk of severe complications such as bleeding, patients might need transfusions of blood products like platelets or fresh frozen plasma. Regular assessments are crucial to monitor and support organ functions, particularly the kidneys and liver, which may be severely affected by the virus. Isolation and stringent infection control measures are critical to prevent the spread of the infection, especially in healthcare environments. Healthcare workers must use personal protective equipment, PPE, to safeguard themselves and prevent further transmission of the virus. While specific treatments targeting Lujo virus are not available, research into antiviral drugs for related viruses may eventually provide potential treatment options. In outbreak situations, health authorities may consider the application of experimental therapies under compassionate use protocols. Supportive therapies may also be employed, including medications to manage fever, pain, and nausea. Interventions such as dialysis might be necessary for supporting failing organs, depending on the severity of the patient's condition. Overall, the approach to managing a Lujo virus infection is multifaceted, requiring a coordinated response from public health officials, infectious disease specialists, and hospital-based care teams, with a strong emphasis on both treatment and containment strategies.